Welcome to How Ergonomic Principles Enhance Caregiver Experience, a webinar brought to you by Medical Construction and Design magazine and sponsored by Midmark Corporation. If you look below the event window under Handouts, you will find links to additional documentation and a copy of this presentation, which you are welcome to download. At any time, you can type questions into the text box on your screen and press Enter. At the conclusion of the presentation, questions will be read out loud, and we will try to get to as many as possible. If your question is not answered, we will try to respond to you after the webinar. Our speakers today are Darren Whittington and Scott Straight from Midmark Corporation. Darren Whittington has devoted his career to design engineering for non-acute clinical spaces. At Midmark, he manages products in all three of the company's business units: medical, dental, and animal health. Whittington leads engineering teams from concept to completion to ensure Midmark maintains the innovation and quality that customers expect. He is active in industry leadership and is a Six Sigma champion. Scott Straight is a leader in Midmark's efforts for the non-acute healthcare space. He supports the company's commitment to enhance patient caregiver experience through the strategic design of equipment and workflows at the point of care. He also helps to define customer needs and conducts research and development on new cabinetry concepts. His expertise is in lean manufacturing, capital equipment, business development, and medical devices design and engineering. And now, please welcome Darren.
All right. Well, thank you, Debbie, for that intro. Hello, everyone. Happy Thursday. I hope everyone's having a great day. So we'll get started here. We'll tell you a little bit about Midmark. Scott and I will today. Midmark is a leader in the clinical design. Our designs and our products are focused on enabling positive clinical outcomes. By that, we focus on improving the experience between the patient and the caregiver. This is something that we are always looking for new, innovative ideas on ways to improve that interaction. We also design clinical ecosystems on which many physicians practice medicine with the equipment that we make here at Midmark. Exam chairs, we do lighting, seating, cabinetry, which you'll see here later in the presentation, diagnostic devices, and then our mobile workstations too. And what we're trying to do is bring it all together through a coordinated workflow to focus on the many critical elements like the patient and the staff safety, ergonomics, and just to create that positive clinical outcome. Scott, I will leave the next ones over to you for the objectives.
Good afternoon, everyone. Scott, just on this first screen, we'll just kind of highlight what our learning objectives are today for this webinar. So we're hoping to convey the understanding the importance of design at the point of care. We're hoping also that we can show you how not all equipment is designed for today's diverse health care workers. And then also on the positive side, ways in which we can enhance that experience through the right design. So looking at the concept, better care starts with a better designed experience. The design of clinical space is truly strategic to the point of care ecosystem. With our goal to provide a better patient outcomes, here at Midmark, we feel it's imperative that we first understand the clinical workflow and design the space to be the most effective that will allow the clinician to provide the best patient outcomes. Being an engineer, I put it down into a mathematical equation. I say better design equals better patient outcomes.
All right, so let's look at the caregiver experience. Growing attention on comfort and well-being of the caregivers is becoming more and more apparent here in the clinic space. So value-based reimbursement models place greater focus on the experience at the point of care. In the past, primary focus has always been the patient experience, is what we looked at here at Midmark. But as we're evolving, the caregiver experience is equally important, and not only for the well-being, but for the care provided as well. And as you can see there, most injured group of workers in the U.S. are the caregiver. 1 in 5 injuries reported in the U.S. are healthcare related. That's from the U.S. Bureau of Labor Statistics. Healthcare workers, this is interesting, are 3 times as likely to suffer from work-related injuries than construction workers. So that one there kind of threw me off when I was looking at that. So that's what we look at when we're designing our products and looking at it. And the most common areas that we're seeing for these caregivers, the pains, the back, the shoulders, the neck, the wrists. And what this is being caused from is continuous working in uncomfortable positions. You can see the physician there on the screen. She's bent over. She's got the keyboard in one hand, hunched over, talking to the patient. Bending and stretching to reach supplies and equipment is another one we see. Just poor ergonomics in general when interacting with our equipment or with patients. Once again, the picture you can see her sitting on the stool. Craning the neck to read from a monitor, slumping over computers. And then what another interesting fact was is physicians spend almost half of their time each day on at desk work or on EHRs.
So looking at the cost of an unsafe, uncomfortable environment, what does that look like? Doing some research and going to the U.S. Department of Labor, what we've been able to find that is healthcare provider injuries, what does that cost? It costs nearly billions of dollars a year. When you look at the cost associated with strains, with sprains, inflammation, carpal tunnel, other things that are experienced within the clinicians, that averages about $70,000 per injury. So that is a huge cost to all the medical networks across the country. Not alone dollars, but if you think about the time that is lost from a caregiver not being able to do their work. So millions of hours are lost each year with people being out of their work. So if we look at the environment we work in, the result of this could be a lot lower staff satisfaction, and retention can be a problem there as well. So, looking at not feeling great in your workspace, what can come about from that? We look at nearly 2/3 of U.S. doctors, they feel burnt out or depressed when they're working. So that can have a true impact on that patient-caregiver relationship. And there are a lot of safety implications for the patients as well. So when you think about a clinician going into their environment and feeling stressed out, having some type of injury, that can affect the patient outcome. They can be less engaged with the patient, not listening as well. The fatigue of the caregiver, they can be less attentive. So that can result in errors in the whole caregiver process. So, just looking at this, the whole cost, it can be very traumatic to the entire patient and clinician interaction. One thing that we all as humans want to be comfortable. So, that's a basic human need that we're all desire is to be comfortable. So if we're in a environment that we're not comfortable in, then that's going to affect how we work. Another thing that can cause some issues here, when you look at clinical visits, if you're like me, it's nothing that we never, ever are desiring to do. When you go into a clinician's office, I'm sure everyone has a level of anxiety that they're just not willing to or really desiring to be in that space at that point in time. So when you look at the design of the space, having a space design that is that offers a person ease of feeling, that they go in and they feel comfortable where they're at, it just allows that whole patient-caregiver interaction to be a lot more productive. So it is very important when we look at design and what that does to allow a positive patient outcome.
All right, so now we'll look at the ergonomic principles and equipment design. The equipment specifically designed for healthcare environments and workers, and then eliminate unnecessary stretching and stooping, support better posture and workflow. So the healthcare community is making great strides in understanding and addressing these issues. Many of our customers identify ergonomics at the point of care as a priority, but can find it challenging to execute on that priority. So we're trying to create and maintain a more ergonomic-friendly working environment, equipment that's designed to accommodate the needs of the people working in the environment, and overall, providing the right equipment that can reduce injuries, by eliminating unnecessary stretching, stooping, and supports better posture, whether seating or standing. And you'll see that later in our presentation with some of our products that we'll be highlighting.
So looking at designing equipment for today's caregivers. So looking at the design, it really starts with really understanding the whole flow of work within the clinician office. And what we've done here at Midmark is spend a lot of time with what I refer to as observational research. We can be theoretical about a lot of different things in the way we feel that clinicians operate within the environment, but until you really go out and observe and watch what is taking place in those clinical environments, you really don't have a good understanding of the workflow or how to be efficient in those workflows. So at Midmark, we have a lot of design experts that have went out and studied numerous facilities across the United States, speaking with clinicians, just to determine what are those ergonomic issues that they're dealing with in their facilities today, and looking at design elements that we can take into consideration and address those issues through design. So a buzzword I'll say, evidence-based design approach, that's something that we've really latched onto with our designing process. So, we want to make sure that all of our designs are based upon decisions that we've actually experienced out in the clinical space. So all of our equipment, the room layouts, designs, everything that we do here at Midmark, we look at a best practices of utilizing our evidence-based research to create that equipment.
All right. Continuing on, too much unnecessary stretching and stooping. It seems like I've been using that word stooping like 20 times now. So, all right, the first one, typical cabinetry found in a clinical environment is not designed for the average height healthcare workers. So if you look at that, for example, 76% of the healthcare workers are female, and the average height of a female is 5'4" in the U.S. So you can look at that at the chart there on the side of the typical healthcare worker, the female at 5'4". You can see an 84-inch tall cabinet. You can see the blue is her access availability. With the 24-inch deep base, she can't even reach that. The red represents the 25 degrees lean forward to see where she can reach, and you can clearly see that she can still not get to the back of the cabinet. So it provides little access to available storage and contributes to stress and strain injuries. Typical cabinetry found in the clinical environment was not designed for the average height healthcare worker, as you can see. The standard cabinet is 84 high. The base I was talking about is 24. That causes that unnecessary reach and lean. Research shows that nursing assistants have a 5-time greater risk of musculoskeletal disorders than other workers. The healthcare workers are forced to use stools or other devices to see or reach supplies on the upper shelves of cabinetry. I know Scott and I have been out with marketing just to get out into the space to understand that, and we've seen actual healthcare workers standing on a stool to reach the top shelf. They use it's like a grabber. They'll use those to get to the top shelf as well. So a lot of dangerous situations out there. And as you can see, the standard cabinetry is 27% access to available storage. I mean, it's pretty clear in that picture. And sometimes available storage isn't used because it's not accessible. We found that out as well. That top shelf on a lot of overheads, there's nothing in it. They can't reach it. So.
Okay, so when we look at the stretching and stooping and all the unwanted body movements that someone may do as far as to get into a space, there is a risk of musculoskeletal disorders. And a couple things that we're going to focus on here are our workstations and the exam tables. When you think about a workstation, we're talking about a mobile workstation. The clinician may be doing their input into a laptop on as far as the patient records. So many workstations do not provide an ample range of motion. So when you look at the different range of from a 5% female up to a 95% male, and you look at all of the height and the different lengths of your arms, your legs, things like that, you have to look at a workstation to provide use to every one of those different body styles. So when you look at a workstation, what we're trying to ergonomically make sure that you're in a correct working position. So whether you're sitting or standing, we're wanting to make sure that the computer screen is below your eye level, so you're not getting a neck strain through the day as you're working on that workstation. You're looking at your shoulders to be relaxed with your back straight and supported. So you're looking at a good ergonomic position so you don't get strains in your back. You want your arms close to your body. You're looking at your elbows bent at a 90-degree angle, wrist straight as you're working on that workstation, and your feet flat on the floor. All of these body positions will enhance a good ergonomic position as you're working around a workstation. The other thing that you look at within the clinical space is really poor patient handling practices between a caregiver and a patient. The picture you see on the screen right now is hopefully one that you wouldn't have to experience in the clinical space, but if you're looking at a patient that may have some limited mobility, they may have a handicap, they may be a larger patient. What you don't want to get into from a clinic position is having those clinicians have to lift the patient onto that exam surface. There's a lot of things that could occur during that interchange. One, it poses a real safety risk to both the clinician as far as an injury through the lifting process. It causes a potential injury to the patient if they're not handled correctly as you're lifting them onto that surface. The other thing that I would say is self-esteem. When you're looking at that patient and you're looking at having to be handled and lifted onto a surface, you don't want to belittle a person's self-esteem. So having the correct equipment that allows the space to be very ergonomic and to not create a place where a lot of these disorders can occur, that would be our goal through the designing of that space.
Yeah, I'll add to that a little bit as well. Working on all three PUs, I've been at Midmark for 29 years. Scott, you've been here for how long?
35 years.
35, so we're a couple veterans here. It doesn't seem like we've been here this long. But, you know, the exam table there on the picture, a typical fixed height exam table like that, right around 33 inches. And you could just see it, you know, lifting the patients with, you know, mobility limitations like the picture, you know. The patients are unable to get onto the exam table, and like you said, this inhibits the exam process. It lowers the quality of the care received, and it just diminishes the desired outcome. So this is what we're really taking into account when we do our designs here at Midmark. But that picture is worth 1,000 words right there. So, all right, so let's go on to the part that Scott and I like to talk about, the equipment. This is what we do here. So equipment that adapts to the clinical staff. So we'll start out our exam chairs. We have exam chairs that are fully adjustable. Our exam chairs that we have a couple of 224, 225, I think is the high lows now. They go from 18 inches down to the ground. which I believe is ADA acceptable.
ADA accessible.
And it is 37 inches high. So that previous picture we had on there, you could see how, let me push it back here, how lowering that table down to that 18 inches to that wheelchair height would be a lot easier and would enhance the visit from the patient. Go on one more, there we go. The next one is our mobile workstation. Scott talked about those a little bit. There's a picture of it right there. If you look, he was talking about the different positions. The 5th percentile female, which is basically 5 feet tall, and we want this workstation here accommodates to the 5th percentile female at 5 feet tall, to the 95th percentile male, which is 6'4", and pretty much everyone in between those heights, right?
And the image on the screen right there does depict that. So the standing image of the male is a 95 percentile male in the standing position, and the seated image there is of a 5% female in a seated position, just to show that the work station can accommodate all those different variety of body styles.
Right, and he was talking about the monitors, looking down, all of that. And it was really neat when we did this research. This is actually one of Scott and I's projects that we launched here at Midmark, you know, and the people who were involved with our research, I mean, we had IT building prototypes for us to make sure the IT department could get it together. Operations, you know, on building this thing, does it fit in our lines? Then we were looking at ergonomists, clinicians, facility managers, obviously architects, and we built some prototypes, and it was really neat. We actually did some validation on these things, and we took it out to the West Coast, and I think our marketing started in Washington and went down to California and got a lot of good feedback from some big customers out there, and we actually incorporated those designs here, and it works out pretty good. It's a really nice product. And then next is the cabinetry. It's our cabinetry. Trying to think, there it is. All right, sorry. Our cabinetry, what we're doing is we're designing it for better visibility and access to supplies with less reach, less lean. You know, we're trying to eliminate that. And we got some pictures coming up here where you'll see it. We're trying to eliminate that unnecessary bending, stretching, overreaching. And then another one we do as well is our clinical stools. And they adjust really easily, maneuver, nice casters on them. And we also have backrest on those as well, just to promote that better posture, that straight up instead of that hunchy with our stools. Anything on that? Okay.
So what we'd like to highlight for you right now is a new product that's been recently released here at Midmark, and that's our synthesis wall-hung cabinetry. This was a product that was a result of a lot of that observational research that I spoke about earlier, going out and really getting feedback from clinicians, from ergonomists, just looking at, you know, accessibility to product. A quote that we used throughout this development of the project was one that we received from a clinician during the research, and we thought it was very profound. Their statement was, "We don't need more storage, we need better storage." And if you really think about that, what they're really highlighting is some of the ergonomic principles that we really focused on with this. So when you look at traditional cabinetry that Darren had showed a picture earlier, I mean, you may have a tall cabinet or an overhead cabinet that the upper portion of that's 84 inches off the floor. And what we found with research and going out into the clinical space, when you went into these environments and you started looking at this equipment and you saw empty spaces, and those mainly empty spaces were at those upper limits of the product where hardly anyone could reach. The other part was when you looked at, let's say, the bottom drawer of a base cabinet. No one would be putting anything in there that they were accessing frequently throughout a procedure. And here again, it's because of the stooping, it's because of the bending over. So the areas of the cabinetry where you didn't have good ergonomics were the places that they just weren't utilizing for storage. So when we started looking at that further, I said, well, we can design that out and make it better and make it easier to utilize the space that is in a good ergonomic position. When you look at some of the demographics of clinicians, one of the numbers is 76% of healthcare workers in the U.S. are women. And if you look at most of the cabinetry that is currently out there in the clinical space, it was not designed to that demographic. So what we try to take that into consideration, the image you see here on the right-hand side with the female's reach, that is a 50% female, and you can see that through the arm movement that they have very good accessibility to that entire cabinet. So that was our goal when we were looking at the design of this product. On an earlier slide, Darren showed that the upper portion of that cabinet was 84 inches off the floor. When you look at this, we are now moved that down to 78 inches. So we've taken that most upper portion of that cabinet and dropped it down 6 inches to make it more accessible to the average clinician. And then when you look at the bottom of the cabinet, we have taken the lower drawer completely out and made the product wall mounted. So there again, so we've eliminated that stooping over and eliminating the drawer that very few used in the clinical space just because it was in a bad ergonomic position. So those are two of the 4 principles that we looked at with our synthesis wall hung cabinetry, and Darren will go into the other 2.
Yeah, and I want to add here, maybe I missed that, Scott, but earlier on the slide, when we were talking about the 84-inch high, and we went to the 78 with the center, we were 24 on the base, now we're 18. Now, if you look, we're at 73% access to available storage. So we increased that quite a bit. And we were at a 25-degree lean for the healthcare worker. Now we're at a 14, and she's able to get to the back of the cabinet. So I just wanted to highlight that.
Yeah.
But
the other benefit of the wall-hung cabinetry, when you look at the base cabinet, a lot of your environments have different requirements in regards to the countertop height off of the floor. So the one advantage of a wall-mounted product, it allows you to adapt that space to whatever the requirement is in the facility. When you look at base cabinetry, a lot of the height off the floor is standard at 36 inches. When you move into more of an ADA requirement, you now move that from 36 down to 34 inches off the floor as far as having that countertop space. And then even a lot of our dental environments, that's height off the floor is 32 inches. So having a wall-mounted product allows you to have the same product and just adapt it by where you mount it to the wall in regards to the height of the countertop off the floor.
Right. Okay. We'll go on to the next one. We'll talk about a little more cabinetry here. So continuing on with the synthesis wall-hung cabinetry, visibility. Improves visibility of items stored toward the back of the cabinet with angled flow shelves. If you look below, you can see the angled flow shelves. We have vents that fit on those flow shelves. Gravity-fed angled flow shelves improves the visibility, access to supplies, even for those items stored towards the back of the cabinet. One of our brochures has a real neat saying in there. It says, "You cannot reach what you cannot see," and that really, you can really see it there. I mean, she can see that top shelf. And it's just like at home in our kitchens. I don't think we use that top shelf on our cabinets. We do, but we have to get a stool to get it. So we avoid that, and we found that out through our study that taller cabinet was doing that. And then the other thing we'll talk about on the wall hung is the infection prevention. So we're going to free up some floor space for easier cleaning, disinfecting in the high traffic areas and the treatment spaces. You know, it's just that off the floor design just helps infection prevention, and it's just allowing for better cleaning.
Yep, I think coming out of the pandemic area here within a lot of the clinics, I mean, infection prevention has been very key in regards to ensuring a safe environment for both the patient and the clinician. So having a way in which that you can keep the entire room infection-free is very key with your designs.
Yeah. All right. Go on.
So looking at the right design partner. So clinical design experts. As you consider designing a clinical space, it's important that you partner with the right equipment provider. Midmark is a leading medical solutions provider focused on the design of the clinical environment to improve the healthcare experience. We've worked closely with healthcare staff, ergonomics experts, design equipment that create a safe, comfortable, and efficient environment. Why do we do this? At Midmark, that we believe that who's using our technology is every bit as important as how and why it's being used. Improving that experience between the patient and the caregiver is at the heart of everything that we do. Midmark is here to assist in the planning and the design of the clinical environment from the initial stages throughout the project. Involving us early in that stage can reduce rework and unnecessary costs. We have several teammates that have earned their evidence-based design and certification from the Center of Healthcare Design, and we are dedicated to helping you apply design and construction practices to enhance that healthcare experience. We have a lot of different resources and different ways that we can consult you through this process. We have Revit files for the A&D community, technical drawings. We have leads credit summaries for a lot of our products. If you're looking at areas in which seismic mounting comes into play, we have OSHPAD and HCA pre-approval numbers. Looking at the overall dimensions of the rooms, we have a lot of different things that we can help you out there. Another service that Midmark provides is our Midmark delivery service. So if you're looking at having a way for a team to efficiently come in and assist with that installation of the product, Midmark does have a team that allows you to do that efficiently as well. So today, hopefully, we've been able to communicate the importance of design at the point of care in several aspects to consider when looking at clinical space design. Additionally, how the design can influence the overall satisfaction of both the clinician and patient experience. And once again, better design equals better patient outcomes. And that concludes our presentation.
All right.
Well, thank you both, Darren and Scott. We appreciate your great insights here today. And at this time, we would like to take questions from the audience. So please remember, you can type your questions into the toolbox on your text screen or text box on your screen and press enter. We will pause for just a moment while we assemble a few questions here. It looks like we have a few coming in. And I think the first one here, I will kick over to Scott. Our question from the audience is, where does the CPU or computer processing unit sit in the mobile workstation?
Okay, so the CPU itself depends on what type of a computer system you're using. So traditionally, when you're looking at a workstation, we're seeing a laptop as being the main type of CPU or computer system being used on that. There are also another popular that we see used a lot is a all-in-one, where the computer itself, the CPU unit, is built into the monitor itself. When you're looking at I'll call it a traditional tower, that is not something that we are normally seeing on being mounted onto a workstation. Just the physical size of that is not something that is as primarily used. We do offer an accessory that does mount on the lower part of the workstation, in which you can mount a CPU if that is the desired means of your computer system. But in general, we are seeing more laptops and all-in-ones on a workstation to be the most efficient method of patient records and on that system.
And another question related to workstations, Scott, is do you have wall-mounted workstations?
Yes, we do. So we do have 3 different versions of wall-mounted workstations that allow a flex arm to be mounted directly to the wall, and then it allows the work surface to extend out next to the exam table. Here again, trying to get that clinician right next to the table, right, so they're face-to-face with the patient itself, just to have a very one-on-one dialogue during the patient exam. But we do offer a wall-mounted version of the workstations in addition to the mobile workstations.
All right, very good. Darren, this might be a good question for you. What type of exam surfaces solve all of the problems for patients and caregivers?
Well, that's a great question. I guess I'm trying to figure out what type of exam surfaces. Maybe like a cabinet, or are we talking exam chair, or not for sure really?
Thinking it might be exam chairs.
Okay. So, so what kind of exam surfaces to solve all? I would say from a clinician standpoint, I would probably lean towards our exam tables. We talked about the 224, the 225, the low height. That surface actually goes down to 18 inches and up to 37 inches, which allows for that patient transfer. Even that patient, elderly, the obese, which we're seeing in the world right now, to actually enter that table, to sit on that table easier. And I think that also plays a big factor for the clinician as well.
Okay.
So hopefully that answers the question.
A couple more here. Between the both of you, what surprised you the most when conducting your cabinetry research with customers?
Good question. I think the thing that has surprised me the most going out and being in the clinician space and just observing, to me, seems like we are creatures of habit. Would be my big surprise. So if you look at all the inefficiencies that goes on in the clinical space, I think we adapt to what we have, and to the point that we don't look for a better way of doing our work, for having a better experience, for working in a better ergonomic situation, that we're given a space to work in, and we adapt to it, and we just kind of go on about our daily business and not really look at improvement. So probably the biggest surprise I had was all the inefficiencies that do exist in the clinical space, and that how clinicians adapt to those and just work around them, and maybe to the point where they don't even realize that it's an issue. That's probably been my biggest surprise.
Yeah. I'll add on to that a little bit too. So we started our research on the cabinetry, with the customers, getting out into the space. I mentioned the stool. I mentioned the grabber going higher. A lot of aha moments. Finding out that bottom drawer we don't use as much as we thought we did. My garage, I use it for my junk drawer. But in a lot of the office spaces, they weren't even using it, or it was indeed a junk drawer. But I think the one that really stands out the most, and Scott said it earlier, is we didn't need more storage. We needed better storage. And I think the synthesis really speaks to that with the 18-inch deep base, the shorter and all that. So that was probably my aha, was just the inefficiencies that people work around. So.
Okay. One of our other questions here is Midmark a turnkey operation from concept to construction? And does Midmark supply products to local dealers and contractors for distribution?
So Midmark is not in the construction business. We are turnkey in regards to assisting with the design of your clinical space. So we do have a team in-house that we can assist with the early concepts into designing the workflows that fit into your space, into your environment. So we do have a start from the conceptual process through our fabrication and distribution of our products. We do sell through local dealerships. We do not sell through local contractors. No. It's all through a dealership network. Yep. But so I would say Midmark is turnkey in from the ideation of the concept space all the way to delivering and potentially installing the product in the clinical space. As I mentioned, we do offer our Midmark design services. Midmark delivery services does offer installation assistance. So that would be our turnkey from ideation all the way through installation.
Right. Yep, that was a good answer.
Okay. This is another question related to cabinetry.
Okay.
And it is, can the same ergonomics be achieved by traditional millwork?
That's a great question. I mean, I would say yes, but the advantage of our census is that we're configurable. I mean, we can configure pretty much anything you want within a certain extent. We do offer to our cabinets are steel. Help me out here, Scott.
I guess when you look at traditional millwork, I'm thinking of standard cabinets. I can go out to a Lowe's, a Home Depot, something like that, and purchase. And I would say to answer that question, it would be no, that same ergonomics cannot be achieved by traditional millwork. If you have a contractor that is doing wood cabinetry and you can have some specialized product made, then there is potential to obtain those ergonomics. But if I was looking at a standard cabinet that could be purchased just off the market, I would say that same ergonomics is not available today from what I've seen.
Okay.
All right. Well, that looks like all of the questions we have today. So, Debbie, I believe I'll turn it over to you.
Thank you, Tanya. If you would like to watch a replay of this webinar, it would be found on the MCD website in the next week at mcdmag.com/webinars. Thank you for your participation and have a nice day.